This is the Art Beauty Podcast, where we are always reaching for truth and beauty. Remember, the guests on the show are not paying to be here, so we get to have honest conversations with them because you deserve to be informed, so you can make the best choices for yourself. With that said, I'm Amber, and today my fabulous co-host is Dr. Konstantin. He is a board-certified facial plastic surgeon. He is going to be here today talking to us all about fillers, more importantly, removing fillers. But before we get into that, welcome to the show, Dr. Konstantin. Great to have you here.
Thank you, Amber. It's a pleasure.
Now, you are practicing in New York, correct?
Yes, that's correct. I practice in New York, and I am specializing in facial rejuvenation, facelifts, and all the cosmetic procedures around the face.
Now, it's funny, so I have to be honest, my audience knows this. I don't have a ton of experience myself with fillers, Botox, forever. But when it comes to fillers, I think these days it's like, people go to med spas, people go to their dermatologist. Do you feel that probably going to a facial plastic surgeon, somebody who specifically specializes in the face, is maybe the way to go when you're going your first time?
Well, it's definitely all those specialties are well qualified. Cosmetic dermatology colleagues are fantastic at doing Botox and fillers. And the reason for somebody would be to go to a surgeon for fillers, for example, is you might want somebody who is an expert in many different procedures, so they select the right procedure for you. Not necessarily you want somebody who does something very well, but doesn't really do anything else. It's like a hammer and everything looks like a nail. So they might take certain treatments a little too far. Now, somebody of my specialty, when people come, we typically start them with Botox, then we add a little filler, then we might add a small surgical procedure, then we might recommend a bigger surgical procedure. So it's pretty much a comprehensive care, comprehensive treatment for somebody who's concerned about aging process in their face.
Amazing. And I'm glad you brought that up, because I don't want my audience thinking here like, well, wait, going to a facial plastic surgeon, that seems like overkill. The reason I wanted to bring you on today is because we know it's the holiday season. I have to imagine there's an uptick in people looking for that non-surgical refreshment, let's say. But I think that it is equally as important. Fillers are a wonderful option, but it's equally as important to know about dissolving fillers, about what you can do if and when they go wrong. Am I correct?
Yes, absolutely. That's correct. So dissolving, and not many people actually know that we can dissolve the filler. Dissolving the filler became very important part of the process. And of course, people use fillers when they lose volume, when they have wrinkles, when they want to improve the texture and the contour of the face and the skin. But not necessarily somebody would like their appearance after they've done the filler. So many times people feel, well, I think my cheeks need to be a little fuller. Let me try to put the filler there. And they go home, and in a couple of days, they realize, I don't quite like it. This is not me. These are not my cheek. Now, fillers, of course, would last for about a year or two after they inject it. So somebody would just get stuck with that look that they don't like. But fortunately, we can dissolve, if not all, then most of those fillers. And the medication that we use to dissolve this is called Hylenex, no relation to that company. It's one of them. The other one is called Vitrace. It became a part of this whole remodeling of the face, or use of fillers to rejuvenate the face, because we can adjust we can get rid of the filler entirely. If somebody did their lips and they realize, I can't stand how I look on the pictures with lips like that, right? We can just get rid of the filler entirely. Or we can gently remodel it. If we inject a certain amount of filler and the patient feels like, no, it may be a little too much, or I want my lips to be a little thinner on the sides and maybe slightly fuller in the middle, right? We can go ahead and we can adjust those fillers by strategically removing them in some areas.
So, you bring up a good point, and I want to be very clear here today. When do fillers need to be dissolved? So one of them is if perhaps it was overdone, or maybe the patient doesn't like it as much. Are there other options that people are coming to you saying when dissolving filler is the best course of action?
Well, the other situation would be medical, of course, because fillers, just like any medication, it can have a side effects. And specifically hyaluronic acid fillers, they attract water, right? And this is why they are so great, because water gives us the plumpness and the elasticity in the skin. But at the same time, they can just attract too much water to certain area. So people end up with maybe bags under the eyes or some swelling in certain areas. And that swelling can last as long as the filler lasts. So for a year or two, obviously nobody wants to walk around swollen. So then for medical reasons, we dissolve that filler to get rid of the swelling that sometimes might come along with it.
So, we're talking about fillers, and I do know, I'm glad you mentioned before the hyaluronic acid-based fillers. Is that important? Are there certain fillers that can be dissolved and certain that cannot be dissolved?
Yes, absolutely. So there's the whole range of fillers. And fortunately, hyaluronic acid is the most common filler that we use. But other ones, things like silicone permanent fillers, which typically I don't recommend using, but in some situations, of course, it could be appropriate. Those fillers don't get dissolved at all, and they don't go away after they inject it. Now, there are other fillers like hydroxyapatite that works beautifully well, but it cannot be dissolved. So before you do it, you got to make sure that this is the right filler for you, and you know exactly what you're doing, because if you're unhappy, you just cannot get rid of it.
And if you don't mind, I don't mean to put you on the spot here, but can you mention some of the brand names of these fillers because I think that most people might be familiar with them a little bit better. They cannot be dissolved.
Of course. Yeah. So Radius would be one of the fillers that cannot be dissolved. Bellafill is another filler that's either permanent or nearly permanent, or at least very long lasting, that could not be dissolved.
Okay. And Sculptra, is that another one?
Sculptra is the filler that cannot be dissolved, but it's a temporary filler. It goes away on its own.
Okay, great. Okay. So, with some of these permanent fillers, before we get on to sort of the process of dissolving, which were the ones that you said you don't recommend? The silicone-based ones? Are there?
So silicone, it could be appropriate in certain situations, right? But for most cosmetic patients, for people that are interested in facial rejuvenation or slowing down the aging process, that may not be the right filler, because the face constantly changes. And the filler that was done 10 years ago now could be completely out of place, doesn't serve the purpose, doesn't belong there. But since it's a permanent filler, you really cannot do anything with it. You cannot get rid of it. So that's why in those situations, silicone would not be, in my opinion, would not be appropriate way to treat the face.
And, we're talking about these kind of quote unquote permanent ones, but for most of the hyaluronic acid fillers, they've got a lifespan of what? About 12 to 20 months?
Depending on the filler. And fortunately, we have the whole range here. So it can last from 6 months to 2 years, right? Okay. And of course, those are averages, because every patient is different. And every filler may behave differently depending on the patient, depending on the facial structure, and on the purpose and the location where we inject. Do I make it complicated enough?
Yeah. No, I mean, well, listen, and this is why you want to go to a qualified professional who, one, has a range of options available. I always say this, be careful, don't go to the person who only has one laser, because they're going to push you for that laser. You want to make sure that you're getting the right laser filler, whatever it might be for your particular needs. When it comes to this idea of fillers and dissolving them now, right? So what does that process look like? And also, when should you come in, right? Because I know if you have filler, with most fillers, you're going to look over swollen at first, right? So you shouldn't go home like the next day if you wake up swollen and say, oh my God, this is too much, I've got to go dissolve it, right? What is the guidelines for that?
Yes, so you're absolutely right. Most people, and this is where I get those calls from patients, especially the ones that do the lip. They call me the next morning and they say, "Oh my God, it's too much. Can I come in and we get rid of it?" And I have to tell them, "Look, no, this is just normal. This is the swelling. It's going to be going away." So I would definitely recommend waiting for at least a week, preferably 2 weeks after you had the filler injected. And if swelling persists beyond that time, then you might consider dissolving the filler or not dissolving. You have to have a discussion with your plastic surgeon or the dermatologist or the person who was injecting it. And based on their experience, either treat the area or give it a little bit more time.
Now, do you find that people, we talked about the lips, and I've heard this before, that if they don't call the next day and they like the way they look, that generally they're back for more in 2 or 3 weeks once that swelling goes down? Yeah.
That is absolutely true. And I tell everybody, if you like your lips the next day, then you have to get more, because that fullness is just going to go away over time.
Okay, so when you're getting filler, if you've done it for the first time, there is some normal swelling. So the recommendation is don't freak out. This is normal. Make sure that you wait a week or two, preferably, before you consider dissolving. That said, let's say that you're in a situation, you're like, this doesn't look like my cheek. This doesn't look like my lip. I don't like the placement of this. What is that process for dissolving filler?
So it starts with discussion. Right. Okay. So we have to sit down and talk and look at the face using the mirror, maybe take some pictures, go over everything, make sure we're doing the right thing, because we are not going to we don't want to end up in a situation when you put the filler, then dissolve it, then put another filler somewhere else and then dissolve it again. So it's not the best way to treat the face, because obviously every time we do the injections, there's a potential side effect. So we have to make sure that we do the right thing every time we use some kind of injection on the face. Now, if we both certain, the doctor and the patient, we both certain that, well, aesthetically, it's not the best look and we do have to get rid of it, then of course we go into a process of dissolving. Typically in my office, it starts with using the numbing cream, because nobody wants to feel those pinches. And then we use a special device that creates vibration, and that really helps with the pain. I take the medication. Typically, I dilute it because I found it just works a little better when it's not very concentrated, and we inject it to the area where I know there is filler, and this way it starts dissolving it. Now, this medication is enzyme. It just chops the filler into smaller pieces, and the filler gets reabsorbed. Typically, it happens fairly quickly. Within a couple of days, the patient should see the reduction of the swelling and the filler is going away. On occasion, it gets worse before getting better, right? Okay. So it's a possibility. It doesn't happen very often, but sometimes when we're dissolving the filler, the swelling can actually increase for a day or two, and then it starts going away.
I mean, I'm just thinking about all the people, if you're going through this and then it gets worse before it gets better, I'm here for you. I feel that must be an awful feeling. Again, another PSA on why you want to go to a reputable doctor or surgeon that you trust. With this, you mentioned before that there are some side effects. So what are some of the side effects of not only getting filler, but then having to dissolve it?
Right. So getting filler, of course, there could be possibility of allergic reaction, any kind of, just anything that goes along with injection, things like infection. We have to make sure that everything is sterile. We have to make sure we inject it right, we inject it to the right place. And then vascular occlusion is one of those dreaded complications that happens maybe once in a million, but it's real. So we have to be very mindful of that. Now, dissolving the filler typically is a fairly safe process. It's considered to be much safer than actually injecting the filler, and that's pretty safe on its own. So dissolving the filler, most we have to warn the patients that they might get some bruising, they might get increased swelling, they might feel a little bit of pain for a short period of time, but then it's just going to go away.
Now, are there areas that, we mentioned that you can dissolve the hyaluronic acid-based fillers. Are there areas, though, that you can't dissolve them as well?
It becomes hard to dissolve old filler.
Okay.
Not necessarily specific to the area, but when the filler was placed some time ago, maybe a year ago, and this is the reason why I recommend people, once you see the swelling that doesn't go away, then go to the doctor and take care of it. Because the longer the filler sits there, the further it's going to spread throughout the tissue, just with normal facial movement, with smiling, with talking. The filler is just going to be moving all around all those muscles. So finding that filler and injecting it exactly into the area where the filler is becomes harder and harder as the time goes on. So that can create a problem. And sometimes people who had the filler done 2 years ago and they still have swelling, we go through rounds and rounds of those injections trying to find that specific area where the filler sits now and where it's causing the problem.
You brought up a good point because you keep mentioning that, this filler that you have to inject where the filler was, you need to figure that out. In general, if you are going to a doctor who you trust, not a Groupon where you got the filler and then you go to another doctor to fix it. But do you recommend sticking with the same doctor, if you trust them, who did the filler to also do the dissolving because they'll at least know where it was placed? Or can another qualified medical professional generally be able to tell where that filler is sitting?
Yes, you're absolutely right. So first thing, and when somebody calls my office and say they want to dissolve filler, my receptionist would tell them we recommend actually going to the same doctor. But if doctor is not available or the relationship with that doctor might be broken and people want to look for somebody else, definitely we will help to dissolve the filler, but the best person to dissolve it would be the doctor who injected it because they know exactly where they placed the filler and where to find it.
Another thing that's so interesting is that you talk about old filler, right? But for these hyaluronic-based acids that last between, you said 6 months to 24 months, about 2 years, shouldn't it all be gone by that point? 2 years later, shouldn't there be no sort of semblance of that? Or are there, do we need to make sure that we're keeping track of where we've had everything done?
Unfortunately, it's not. And here we entering some pharmacology and the concept of half-life, right? So the filler might take years and years and years for the filler to go away completely. It just becomes less and less and less of it. And even though the external manifestations of the filler are pretty much gone and might be gone for a year or two, there's still a very small amount of that filler that could be sitting there in a tissue, and that's going to be getting smaller and smaller, but it still can cause the side effects such as swelling.
So one thing I have to ask before I let you go is, do you find, there was such a boom in fillers, and I feel like now there are, technology is always changing. As a facial plastic surgeon, are there times when you would say to people, maybe don't get filler if you think you might need a facelift down the road because it might cause scar tissue, or are there any concerns there, for somebody who's thinking about filler? I know with threads, the reason that I'm getting this, those facial threads, I spoke to a lot of plastic surgeons who say they won't operate on people who had threading because of the scar tissue. So when it comes to, or it presents a lot of problems. Is that the same with fillers? Is there anything that we should be thinking about before we go for our first one?
Depending on the type of filler and depending on the area that's injected. So certain fillers like Sculptra that you mentioned, it's known to leave the scar tissue behind. So those fillers definitely, if somebody is considering a facelift, may not be ideal of getting Sculptra a few years before the facelift because it could create sufficient scar tissue to cause not the problem, but maybe some additional difficulties during the surgery. Now, hyaluronic acid fillers considered to be fairly benign as far as creating the scar tissue. So the only reason not to get them is just why spend money on something that may not be necessary. So I tell my patients, if you're planning to get a facelift within 6 months to a year, there is no point of doing the fillers in the cheek or around the jawline, right? It's just not necessary. Why spend the money? On the other hand, if somebody wants to get the fillers in the lips, that would be perfectly fine if they want to get a facelift fairly soon, because one really would not affect the other.
I want to thank you so much for your time today. Before I let you go, are there any sort of Do you have a favorite filler? Do you have a favorite area? Do you think that there's one thing? I know people are so different and every face is different, but is there one that you find really makes that wow difference?
Well, it's either the cheeks or the lips, right? Mm-hmm. So those are the two areas that will create that wow effect among your friends. They will say, "Oh my God, you look good today," right? So, and of course, in the cheeks, in my practice, and I have no relation to the company, I use Juvederm Voluma. Right. Okay. And in the lips, we typically use Volbella. Those are two different fillers. One is much thicker and longer lasting, and another one looks very natural. And that's the reason why we use them in those specific areas.
Dr. Konstantin, I want to thank you so much. I really do appreciate, because I think that some of these procedures that might not seem like a big step, cannot always work for somebody. So it's, I think, equally as important to know, hey, can we undo this? For clarification, Botox is not undoable, correct?
No, Botox is not undoable, but it unfortunately doesn't last quite as long. So even if you're unhappy with the results of Botox, all you have to do is just wait for a couple of months.
Wait it out. Thank you so much for being on with us today. If people want to come and find you, what's the best way for them to reach you?
They can find me online. Of course, they can Google Dr. Konstantin, New York City, or they can call us 212-380-3634.
Amazing. And I will make sure to have that information and those links in the show notes. I want to thank you so much for being on with us today, and happy holidays to you.
Thank you. The same to you.
And if you have questions you want me to pass along to Dr. Konstantin or his team, I'm always happy to do so. You can email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.